The trends in contraceptive uptake in India, and particularly in the state of Madhya Pradesh, has been relatively flat, and there's specific reliance on certain contraceptive methods such as sterilization, followed by natural methods in condoms. Also, the fertility rate in India has been on a steadfast decline, and increasingly programs and governments are focusing on encouraging younger couples to appropriately space their pregnancies. Also, there's been extensive effort that's being made to introduce new methods of contraception for spacing, such as the injectables and the Chaya OCP pills. But what we find is that, really the uptake of these methods is incredibly low. In Madhya Pradesh, while there is some data that's available at the community level, that kind of summarizes a snapshot of these indicators, such as what's the prevalence of modern contraception, unmet need. It doesn't necessarily provide a holistic and quantitative picture of why. So we really wanted to understand, why are couples using one method of contraception versus the other? What are the different drivers of contraception uptake? What's the relative importance of each of those drivers? And also, are they distinct drivers that are different for certain subpopulations in Madhya Pradesh? Cubes served as a checklist for us to evaluate and map all of these different factors that the Cubes model says is important to investigate against what's available and known in the literature to identify knowledge gaps. And for example, what we found was that while a lot of studies widely report on certain factors like emotions, which include fear of side effects from using a contraception, other important factors such as beliefs, so beliefs around risk perceptions, beliefs around whether one should space before the first child, whether one should space before and between pregnancies, the role of social norms and the role of influencers were not necessarily extensively explored in the same studies. So with this understanding of mapping cubes against what's known and identifying the research gaps, we were able to finalize our study design, and we broke that into 2 steps. So it was a mixed method approach. What we found is that in Madhya Pradesh, in India, family planning is a very private decision that largely happens between the woman and her husband. And there's some interaction that happens with a close group of friends and family. The role of the health staff, which in this case is a community healthcare worker known as the ASHA, has to be extremely nuanced. So currently, the CHWs are not necessarily equipped to engage in behavior change counseling to be able to persuade the families. But what they are very, very critical in doing is that they can help in mobilizing couples and facilitating access to contraceptives and then ensuring uptake. So we specifically in our sample looked at women who've had no children so far, and we found a lot of heterogeneity in their drivers of family planning behavior. And given this heterogeneity, we wanted to segment our population to uncover these differences. Given we'd used cubes, we had a rich source of diverse factors to work from, and then it was very easy for us to use machine learning to identify the most important ones and develop segments accordingly. When we did the segmentation, we identified 4 distinct groups of this cohort. Based on the insights we have from our study, and specifically around the role of influencers, we designed and implemented a direct-to-consumer solution that provided contraceptive information and nudges to couples privately that they could access whenever they wanted via a chatbot called Ask Nivi on WhatsApp. The tool was very well promoted and received by community healthcare workers, in this case, the ASHAs in Madhya Pradesh, who found it to be complementary to their efforts in driving contraceptive uptake. We are expanding this effort to include our results from the segmentation analyses to develop and build tailored messaging solutions that target the different channels that these segments use the most.